Hello and welcome to vlog number 169. It's been a while since I've vlogged, but it has been on my mind for a couple of months that I need to update about Exenatide, the type 2 diabetes drug that has been shown in recent clinical trials to arrest or slow progression of Parkinson's disease. I have been unsuccessfully trying since early 2018 to persuade my Norwich neurologist, my London neurologist and my GP to prescribe this drug to me, but my local CCG or Clinical Commissioning Group have denied permission for them to prescribe on the basis that it is not licensed for Parkinson's disease and is considered to be an experimental treatment. Earlier this year I had a routine telephone appointment with one of the senior neurologists at the Norfolk and Norwich Hospital, and during the course of the conversation he asked me what medication I was currently taking. I told him that the only medication that I was taking for Parkinson's was cannabis, in line with my policy of being completely open and honest about my use of cannabis. He responded, "What about Exenatide?" I told him that Exenatide was something that I would like to try, but that it had been denied me by the CCG. "I'll be happy to write you a private prescription, if you'd like," he said. "I'll look into it and let you know the likely cost." Of course, I said that I would like to try, and thanked him profusely. True to his word, he wrote to me to let me know the cost, approximately £100 per month, and offering to write me a prescription for an initial 1-month period. Long story short, I received the private prescription, had it fulfilled at a local pharmacy, was shown how to inject myself by a nurse at my doctor's surgery, and took the drug for a 4-week period. I did not notice any progression during this time, but that doesn't mean that it was due to the Exenatide. My progression comes in fits and starts, and it can be several months of no progression, followed by a week or two where my symptoms become noticeably worse. I emailed the neurologist and requested a prescription for a further 3 months' supply, which arrived through the post the following week. No disease progression was noticed during this 3-month period, and so I sent a further email and requested a prescription for another 3 months' supply. It was during my 5th month of taking Exenatide that I noticed some worsening of symptoms, increased salivation or a decrease in the swallowing reflex, a worsening of my postural instability, meaning that I'm increasingly falling to my left side. I had a close call in the shower but managed to save myself from falling by grabbing the rail that the shower head is attached to, and further voice issues relating to clarity, pitch and volume, meaning that I am constantly having to repeat myself. As you can imagine, I'm extremely disappointed, and I now have a dilemma. Do I discontinue Exenatide on the basis of the recent progression, or do I continue for the time being because it might have slowed progression rather than stopping it? My instinct is to stop because it's not as though this recent progression is trivial, and I also don't want to pour good money after bad. But what if Exenatide is slowing down disease progression? In that case, I'd certainly continue and consider it money well spent. Perhaps I'll email my London neurologist and ask her opinion. She may have a view, considering that the clinical trials were being run by one of the neurologists on her team. Thanks for watching. If you have any questions or have a topic that you'd like me to cover in future vlogs, just leave me a message in the comments and I'll do my best to respond. Have a great week, stay well, see you next Friday.